Hope everyone's still energized for my last presentation today. So my topic today, my name is Chittawan Poonsiri. Okay, and my presentation today is the economic evaluation of Evusheld for pre-exposure prevention of COVID-19 in high-risk population. So I'll start my presentation with what I think everyone might most familiar with during the past few years, the COVID-19 pandemic. So during the pandemic, what happened to us? First, this is quite obvious. Everyone started wearing masks, right? And also, we wash our hand more frequent, and we created social distancing program to help prevent us from getting infected. And also, this is I would say one of the game changer of this pandemic is vaccination. But do you think every people respond to vaccine equally? No, right? So there are still some people, for example, immunocompromised patients, that are still haven't got enough response to COVID vaccine, and this put them into the high risk of getting infection. So it comes the medication called Evusheld, which is a combination between two long-acting monoclonal antibodies, tixagevimab and silgavimab. This medication was approved for pre-exposure prophylaxis in those who have inadequate immune response from COVID-19 vaccine. Anyway, the price of the medication is really high. And imagine if you're a policymaker and want to use this medication to your patients. What do you think? The economic evaluation should be studied, right? So this is the objective of our study, is to evaluate the cost effectiveness and also the budget impact of introducing Evusheld to this group of immunocompromised population from Thai government perspective. So this is the cost utility analysis. The population in this study, as I have mentioned, there were immunocompromised patients, including organ transplant patients, autoimmune diseases patients, and also dialysis patients. So the intervention we use in our study is that the first scenario is that providing Evusheld to all patients. And another scenario is that we do the screening test first, and we will provide Evusheld only to those with low protective immunity. Comparing between the current situation that all patients receive at least 2 doses of COVID-19 vaccines. And the outcome we aim to measure is the incremental cost effectiveness ratio, or ICER. So in this study, we use Markov model with a time horizon of 6 months from payer perspective. And the parameters used in this study is presented here, including the direct medical cost. This one we have from NHSO e-claim data, and also the price of Evusheld and the infection and mortality rate from Department of Disease Control. The screening cost is from Department of Medical Science, and the mortality rate of general population is from burden of disease and injuries in Thai population in 2014. And the other parameters, including efficacy of Evusheld, the proportion of patients with low protective immunity, and also utility parameters are from literature review. So let's have a look on our Markov model. Imagine one immunocompromised patient. Do you think they will stay in a healthy state and with a high protection from infected? No, right? So we start our Markov model with the susceptible state, which means the patient is at high risk of getting infection. And then patients can turn to be infected, severe infected, recover, or maybe dead. So giving Evusheld to this group of population, we assume that this medication can shift the patients transferring from susceptible state to recover state. So this can help prevent them from turning to infected or severe infected. So let's have a look on our result. Focusing on the column in the middle, which is the situation that providing Evusheld to all patients. You can see that the ICER is really high, which is around 2 million in organ transplant patients, 15 million in autoimmune diseases, and around 5,400,000 in dialysis patients. Comparing between the one on your right-hand side, which is we do the screening test first and only provide Evusheld to those with low protective immunity. You can see that the ICER is reduced to be around 700,000 in organ transplants, 5 million in autoimmune disease, and only 54,000 in dialysis patients. So if we considering using the willingness to pay threshold of Thailand at 160,000 baht per QALY, you can see that the only scenario that consider cost effective in Thai context is the scenario that providing Evusheld to dialysis patients who have low protective immunity. So in our study, we also conduct the one-way sensitivity analysis to see that the ICER of the Evusheld is sensitive to which parameters. And you can see here that the ICER of Evusheld is sensitive to the rate of COVID-19 outbreak and also the cost and efficacy of Evusheld. Another parameter that have sensitive to is that the transitional probability from moving from a recovered state to susceptible state, and also the proportion of inadequate anti-S titers. So let's have a look on the price of Evusheld that will be considered cost-effective in Thai context. So considering using the Thailand willingness to pay threshold at 160,000, you can see that except the situation of providing Evusheld to dialysis patients with low protective immunity, that is already considered cost-effective in Thai context. The other scenario, the price of Evusheld need to be reduced to around 40 to 80% to make the medication become cost-effective. And here is another objective of our study, which is the budget impact analysis. So you can see the bar on the lowest one is the current situation of providing only vaccination. And the bar in the middle, the longest one here, is the situation of providing Evusheld to all patients, which can result on a very high budget impact, around 470 million. And comparing between the middle one and the upper one, you can see again, if we do the screening test first and providing Evusheld only to those with low protective immunity, the budget impact will reduce more than half to be around only 212 million. So at the current price of Evusheld, providing this medication in dialysis patients with low protective immunity will represent a good value for money in Thai context. But as I have mentioned twice, that the screening test of anti-S titer before providing the medication can represent less than half of the total cost of providing to all. And also it can help make this medication becomes more cost effective as well. And anyway, Evusheld may be less effective with the new variants in the future, so the neutralizing activity should be continuously monitored. So let's have a look on the policy recommendation. As you can see that Evusheld is only cost effective in only some groups of the population only. So if we're gonna implement the policy, there might be something need to be concerned. For example, the ethics and equity before we implement the policy. And also the cost is really high. And in the future, we might need the booster shot as well, or maybe the double shot now. This can result in a very significant financial burden to Thai government. And also, Evusheld may be less effective in the new variants in the future. So the procurement should be done in a very short-term contract. And after this study is done, the result of this study was presented to Thai Cabinet and also the Department of Disease Control, which results in the guideline on providing and managing the long-acting antibody in Thailand, announced by Department of Disease Control this year in July. Yeah, and maybe that's the end of my presentation today. Thank you.
Thank you very much, Chittawan, for your excellent job, and I'm glad that this provided evidence for our policy decision making during the COVID-19. So let's hear from our commentator. Yeah. Dr. Isuna first.
Yeah, thank you and congratulations for the good work that you have done. In terms of the policy implications, because I don't understand. Okay.
Yes.
So currently it is provided to the patients with screening first, or all these high-risk group patients are being provided. One thing, I just want to understand what is the policy like. The other thing is that, did you consider to give additional booster dose compared to Evusheld will be more cost effective or not?
Yeah. Okay, thank you.
Yeah.
So first question about the policy. Sorry that it is all in Thai and I haven't translated it. So the policy they announced first that I have mentioned about the ethics and equity that need to be concerned. So they provide majority. They focusing on providing to the dialysis patient with low protective immunity as we have suggested. So yes, the screening test first before providing Evusheld, but they still consider other group of patients that might still need the medication, but maybe or maybe not. Maybe have the screening test first, or maybe unable to receive the screening test. So they add another point that, or maybe up to the physician choice as well.
Okay.
Yeah.
So in terms of the uptake, so I think the procurement have been done. In terms of the uptake of the treatment, do you give option to patients whether they would like to receive the treatment, or is just a given? I think because in Malaysia, not for Evusheld, for Paxlovid, so it's advised to the patients, but it's up to them whether to receive or not.
Oh,
Yeah,
this is interesting question.
and the uptake.
Okay. Well, as far as I've known, the physician would ask the patient that if they are falls like under criteria that they should receive Evusheld, if they interested in like having it, because can be confirmed if I misunderstand something. I understand that this one, it can be given for free to patient who fall into these criteria. So the doctor might ask the patient first, and if they're interested, then they can have it.
In terms of the acceptance, the patient's acceptance.
Right,
actually, yeah.
right.
Okay.
Okay.
Okay, thank you.
Yes.
And Thai. so it means that just want to clarify that
Right.
so it will now cover for not only people with dialysis, right, but also organ transplant as well, even though it's not cost effective, right? So I took advantage that I can read Thai. So any other question from Alex?
Yeah, so so could I ask you to reflect a little bit on the communication of uncertainty in this model? Because it seems to me that there's more uncertainty here than you would often find in an economic model, because the disease itself is changing. The risk of infection is changing, but then the actual pathogen is also possibly evolving as well. So you've chosen to use deterministic sensitivity analysis to communicate the uncertainty. Did you think about using probabilistic sensitivity analysis as well to reflect this?
Oh, yes. Thank you for the question. Actually, sorry that I haven't put it show in the slide, but we also do the probabilistic sensitivity analysis, and the result is, I mean, similar to the deterministic one. Yes.
As a follow-up question on that aspect, I presume the probabilistic sensitivity analysis would show that there's quite a bit of uncertainty. So has the Thai government considered some sort of managed entry agreement to share the risk with the pharmaceutical company?
Oh, thank you. Well, they might concern on this that I might not know. Okay, but I think that they might have to take this into account in order to like procure this medication. Yeah.
I wouldn't want you to share something that you don't know.
Floor, yes, please. Okay, I think we have 3 at least.
Hi, thank you for the great presentation. I just wanted to ask about the screening test, because you're taking the antibodies as a cross-sectional screening test, but we know that there's a differential rate of decline in the antibody levels over time according to different patients. So I'm not sure if you accounted for that as your screening test. And I'm not sure if I missed out on the question on the booster. So maybe could also address that if I missed it out. So sorry. Yeah, thank you.
Okay, so the screening actually it we will screen the patient first before giving the medication. So in case of at the time of they do the screening test and their immunity is higher than the level, than the criteria, then that patient may not need Evusheld. But if their immunity drops like lower than the criteria, then they will receive the Evusheld. And also the booster dose, yes, yeah, it might have to actually from the guideline, as I have known, maybe someone can add if they know, yeah. But they still like did not take account on the booster dose as well. But they also have some recommendations on using booster dose for this medication as well. Yes.
Add on, please.
Unrelated. So I have a question about the initial study because it seems like I totally might have missed it during your presentation. So it seems like vulnerability is defined as organ transplant, dialysis, and autoimmune disorders. So I'm just kind of wondering if you have tried different things with a definition of vulnerable population, because I think in some other parts of the world, for example, COPD, long-term, like other chronic diseases, diabetes. So like, I think you would exponentially start including more and more individuals. Is that still gonna, like, how inclusive can you be to make it still cost effective?
Okay. Interesting question. Okay. Thank you. Yes, for vulnerable patients, yes, there might be more patients, including, for example, cancer patients or other type of diseases, right? But the reason that we end up with only three groups of these population is because they were the three groups of population that has a high I would say higher rate of getting infection and death from COVID-19 in Thailand. From the data from the Department of Disease Control. So we focus on these three group of population. And also as you can see from the one-way sensitivity analysis, the rate of the COVID-19 outbreak and also the in case of the patient has like higher risk of getting infection, that might affect the cost effectiveness of the medication as well. So in other groups of patients that has like different rates of infection might affect the the cost effectiveness of the medication. So we might have to run the model again if we have the data of those patients.
Okay, any other comments or you want to add more, please? I saw 3 people, but that's just 2. That's fine. Okay, please.
I'm Varanya. I'm also working at the hospital, so I like to share. I think this project is a special, not a request, but a program by Disease Department of the Control, Ministry of Public Health. So I'm not sure whether I can speak here, but if I cannot, maybe we keep in this room. I think because in Thailand we have the expired vaccine from the same company. So this is why they want to exchange between the expired vaccine to the medicine. So we have the limited resource, and this is why we try to prioritize the special group of the patient that we like to provide the Evusheld first. So this is why the reason why we come up with the 3 priority disease, and this is because of the, like Chittawan mentioned, that it's because the high mortality rate and the high disease burden. And at the hospital, the medicine will provide it for free by Disease Department Control. The doctor will check the criteria. Oh, is it time up for me?
Continue.
You can finish though.
Okay, and once the patient are eligible to the criteria, they will get the medicine for free. Yes.
Okay, thank you very much though.
Thank you.
I think no more question because this the end of the day already. And thank you for your excellent presentation. And okay, I think because we should end the section, and I would like